Small ruminant medicine, the prolapse of the uterus and vagina. Vaginal prolapse only happens in 1% of cases. It occurs in the last month of gestation. The uterine body and uterine horns can also be involved. It is caused by excess body conditioning score, a multi-gravity uterus, high fibre diet and hypocalcemia, as well as lameness, short dock tails and abdominal straining. The consequences are prolonged straining, early onset of birth, abortion, pregnancy toxemia, and a dorsal vaginal wall rupture. The signs can be difficult to see due to a long fleece or non-dock tail, but signs can include isolation, not eating concentrates and vocalization, as well as lateral recumbency. The animal will be in a lot of pain, and it will seem like it's having frequent urination without urine, as well as abdominal straining. It can become contaminated with feces, bedding and soil, which allows toxin uptake. And hemorrhages can occur, which will lead to pale mucous membranes, vaginal tears and internal bleeding. You need to check the fetus viability by doing a trans-abdominal ultrasound, or checking the fetal heart rate. It can be difficult to detect. It usually takes around 5 minutes to find it. If there is a smelly discharge, there's a poor prognosis. For the treatment, you need to do a C-section and reposition the vagina. In a standing yo, a Bunner suture is best. You leave it for 3 to 4 days. You can also use a plastic retention device, which is tied to the fleece, or do single uninterrupted sutures, but it's edematous. And make sure the yo is in a well-bedded pen for 36 hours. If there are permanent prolapses, you need to cull the animal. Complications include abortion within 24 to 48 hours and incomplete cervix dilation. Uterine prolapse occurs just after lambing. It can occur 12 to 48 hours after lambing. The cause is a large single fetus, or a prolonged second stage of birth, or an unskilled assistance, which allows more abdominal pain to happen and more straining. And the signs are the caruncles are visible. For the treatment, you do an epidural anesthesia, you reposition, and you can do a Bunner tape method closure, as well as giving antibiotics and NSAIDs for pain control. If a prolapse reoccurs, exclude from breeding and cull the animal.